Welcome everybody to the Cowtown webinar series presented by Baylor Scott & White All Saints Medical Center in Fort Worth. We are so glad that you could join us today for this wonderful presentation on skincare for marathon runners. Take it away, Dr. Readinger.
Okay, great. Thank you so much for having me. I'm Dr. Allison Readinger. I'm a board-certified dermatologist. I practice here in Fort Worth, and I'm pleased to be on staff at Baylor Scott & White All Saints. And my topic today is skincare for marathon runners, in it for the long haul. So can't wait to share some of my tips with you. Okay, so what's unique about marathon runners? Anytime you think about a marathon runner, you think about someone who takes good care of their body. They maintain a intense training schedule and the diet to support the long runs. And you think of them as someone who's in tip-top shape. So what about their skin? Well, it turns out they may be at higher risk for skin cancer. And so that's what I wanted to talk to you about today. So what are the risks for marathon runners? We know that because they're out there doing these long runs, there is a risk for higher cumulative sun damage. And as you can see in this slide, there's actually more than two kinds, but two main kinds of UV rays. We have UVA, which is a longer wavelength and it penetrates deeper in the skin. And we have UVB, which is a shorter wavelength that penetrates to the level of the epidermis. And these two wavelengths were generally thought of for a long time to cause different kinds of damage. UVA causes oxidative stress, and predominantly we thought of it as causing aging. And UVB, because it directly damages the DNA, we thought, well, UVB causes more skin cancer. Well, it turns out they're both involved. And the higher cumulative sun damage you have, that's all adding up over your lifetime, has been proven to result in more squamous cell skin cancer. And then UV light and intense UV light in your childhood or adolescent years is associated with more basal cell skin cancer. And those are the two most common types of skin cancer. So marathon runners, just due to their lifetime UV sun damage buildup, are probably at higher risk for skin cancer. And then what about those runs where marathon runners accidentally forget to put on sunscreen, or we're out there for longer and they get an intermittent sunburn? That also is a risk for skin cancer. And in particular, we worry about melanoma with intermittent sunburns. It's your cumulative sun damage, probably more squamous cell, sunburns in childhood, probably basal cell, but these intermittent sunburns through your adult life, we do worry about that causing melanoma, which is the most dangerous kind of skin cancer. So when you're, doing marathon running, but not stopping for breaks to reapply SPF, or you think that the UV index isn't too high and you get that intermittent sunburn, it's not as innocuous as you might think. And then the third risk that I wanted to bring up is actually just a theory, and it is a theory of post-race immune suppression. So that means that after a race, there is this theoretical period of time from 3 to 72 hours where your immune system may be busy repairing your body instead of fighting the common cold or flu virus, or for instance, repairing the DNA you damaged if you got a sunburn. And this is still a theory. There's a lot of literature on this, but at the same time, it's not really proven. So I just wanted to bring it up. The reason they can't prove this immune suppression being due to running long races is because there's always these other variables like travel and lack of sleep and exposure to a harsh environment that may cause the immune system to be a little down after a race. So it's hard to prove that it's actually the training or the race that causes that. But you might want to keep it in mind, because it'd probably be particularly bad to have direct DNA damage from a sunburn and then become immune suppressed, because that might be how a skin cancer could get started. Okay, so next thing I wanted to talk about is, why do marathon runners perhaps forego putting on their sunscreen? And I've heard many reasons when I talk to my patients. One of them is that they tell me they run early in the morning, and so the UV index was low. Well, that's great if you start your run at 6 in the morning, but if it's a 2 or 3 hour run on those longer training days, you are starting to get into that peak UV index time where it is a little easier to get sunburned. And so keep that in mind, especially with the longer runs. It is helpful to run earlier or later in the day so the UV index is lower. They say sometimes to me, well, it was cloudy and I didn't expect to get sunburned. Well, we know that some of those UV rays do penetrate through the clouds. And so you can still get sunburned on a cloudy day, and it's happened to the best of us. And then some of the other reasons have to do specifically with why people don't want to put sunscreen on in the first place. A lot of people will tell me when they start sweating that it runs in their eyes and stings and burns. Or maybe it feels too occlusive and it's like just this thick layer on their skin and they feel like they're going to overheat. So a lot of people do prefer not to have on sunscreen. However, I think that we can find the right sunscreen that everybody can be happy with, one of the sunscreens out there. And so it's a matter of trying some different ones. All right, so I did want to show you a few slides just to show what skin cancers look like. One of the most common, the most common skin cancer is basal cell carcinoma. And 1 in 3 Caucasian people will get basal cell in their lifetime. And it is present in even dark-skinned people. But, this is the most common skin cancer we see. It can be often pink or skin colored, and rarely it can be pigmented, but most often pink. It can be raised, flat, or even sometimes a little divot. Sometimes it's scaly and sometimes it's shiny. It may bleed easily. As you can see here in this picture, I have one on someone's ear to show you, and it was easily bleeding, so it has a scab on it. It may look more like a mole or a pimple to the patient, but they'll say, well, it started bleeding when I washed my face, or I thought it was a pimple, but it always comes back in the same spot. And so that may be a sign of basal cell. The good news about basal cell is it rarely spreads to other parts of the body. So typically, if you can cut it out or remove it, treat it with a cream or radiate it, you're not really at a huge risk of this spreading to other parts of the body. The rate of spread is less than 1 in 10,000, and it's usually a larger ignored tumor, somebody that didn't go to the doctor right away for it to spread. Okay, so next I will show you the second most common type of skin cancer, and that's called squamous cell carcinoma. And I have a picture of one there that you can see on the back of this gentleman's neck. These are usually pink, rarely pigmented, but most of the time pink or skin colored, and they form a nodule. Sometimes they have a thick skin or a horn in the middle, a thickened scale in the middle. And they can form a little nodule or a thick bump on the skin. It is the second most common type of skin cancer, but it is a little bit more dangerous because it can spread to other parts of the body. And it's got a 2 to 4% rate of spread. Now, if you get one of these, don't panic. It's just important to get it taken care of. Again, sometimes the ones that have spread, the patient hasn't come in to see the doctor that quickly, or it might just be a larger tumor, something 2 centimeters or more. Sometimes the patients that have a high-risk tumor may be immune suppressed, so their body couldn't control the cancer quite as well, or it might occur on a high-risk site, such as your lip or your ear. And in those cases, it's very important to take it seriously and get it treated. So that's squamous cell carcinoma. And then I want to show you the third type of skin cancer, which is malignant melanoma. And this is one that is a particularly dangerous kind of skin cancer because it can spread to other parts of the body easier. It can spread to lymph nodes or to, other organs, but it is completely curable if caught early. And I just wanted to show you, this patient has several several lesions, atypical moles on her back, but there is one kind of right in the center that has more unusual coloration, a slightly irregular border. It's larger. You can see clearly that it's asymmetric. And then we can't tell from the picture, but most of the time these are evolving over time. Now, melanoma is most often dark brown or black, but it could be pink or red or even skin colored. But the point is that if you have a new dark brown or black mole, or it's not really a mole in this case, it's important to go to the doctor and have that checked out, because that is a skin cancer sometimes that can be caught early and treated, and then it won't cause as big of problems. And the other thing to note about melanoma is that it can affect young people. And so sometimes we see patients in their late teens or early 20s with melanoma, and it's particularly devastating for them because a lot of times they're still in that age group where they think nothing bad will happen to them. But it is important that if patients have abnormal moles or a newer changing lesion, that they come in and see the doctor, even if they're still young. All right, and then so what can we do about it? So I thought, what would I tell y'all if I wanted to give you some strategies for sun protection? And the first thing is, I do think it's important to find a sunscreen you don't mind using. And so I put up some different ones here that I'll just kind of highlight. Why would someone pick these different ones? For example, that Bullfrog Quick Gel is very light. It is a quick drying gel, and so it's not going to feel real heavy. If you're somebody that doesn't want to put a lotion on your skin, you could use this Bullfrog gel instead. Let's say you were concerned about chemicals in sunscreen. Well, then you might want to use one that was a zinc oxide based sunscreen. And that sunscreen in the middle, called Blue Lizard, is just zinc and titanium dioxide. And that would have fewer chemicals in it. If you are concerned about chemicals in sunscreen, that would be a good one to use. Or if you are going straight from running to swim in open water and you're concerned about reef safety, that Blue Lizard is also reef safe. Sunbum, so that's another one that is reef safe, but it is more of a chemical-based sunscreen. And I know that's kind of unusual for those two things to be in one sentence, but the Sunbum does not contain those two chemicals that are known to harm the coral reef. But Sunbum is a nice one because they make these sprays, and if you prefer a spray and you're only going to use a spray because it's easier to apply, then that's one that I do like fairly well. However, I do think that there's room for error with a spray, and you have to spray it on where you can actually see it on your skin and not just spray into the air and kind of a little bit of the spray lands on you. It needs to be a good consistent spray, and then maybe rub it in with your hands. And then if you need to do your face and all you have is a spray, then I would spray it into my hand and then apply it onto the face instead of directly spraying your face. And then if cost is a concern, this Equate brand SPF 50 actually got high rankings in the Consumer Reports a couple of years ago. And so this is a good Walmart brand sunscreen that has been tested by consumers and did what it was supposed to do. It's broad spectrum and might be budget friendly. And then this Elta MD UV Sport, it's one I have carried in my office for a long time. And I know for a fact that if this one gets in your eyes, it does not sting or burn. It is a zinc oxide based sunscreen, but it does have one added chemical in it that is not reef safe. So I do prefer that people not use that if they're going from running straight to open water swimming. But that is one I have tested and found to be very good for example, being out in the sun for a couple of hours, not running and not getting in your eyes or stinging. Okay, so good quality sunscreen, and you want to put it on before you leave the house. That's very important because if you wait 10 minutes, you've already started to get some sun damage accumulation. So, you want to find one that's water resistant, so that your long runs, you won't be sweating it off so easily. You want to find one that doesn't sting or burn you. And that's kind of the gist of sunscreens. You also want to look at the container and make sure that it says that it's labeled as a UVA and UVB blocker. So you want to make sure of that, because some of the older sunscreens only blocked UVB, and you want UVA protection as well. All right, so regarding training times, you also may want to seek training at non-peak UV exposure times, so earlier in the morning or later in the afternoon or evening. But even then, still remember to wear your sunscreen. And so that's kind of controlling your risk. But in order to, add to that, detecting skin cancer early, you may want to consider getting a skin exam with a dermatologist every 2 years or so if you have no history of skin cancer and no history of skin cancer in your family. But the reason for that would be just because of all the extra UV exposure. It might be good to get checked out by a dermatologist and schedule a skin check. If you do have a history of skin cancer, or there's a lot of skin cancer in your family, you might want to consider yearly or more frequent skin exams. And so again, just make an appointment with the dermatologist and they'll tell you how often it would be a good idea to be seen. All right, and then just to finish up my talk, I had a couple of additional resources if you want to do reading on subjects of skin cancer or to find a dermatologist. The American Academy of Dermatology has a website where you can, this is kind of the opening page over here on the left. You could click on that link that says for patients in public. And then the second screen over here to the right, down at the bottom, you can enter your zip code and hit go, and it will find you a board certified dermatologist nearest to your zip code. And that way you can make sure you have found somebody who is a board certified dermatologist who has all the appropriate training to detect your skin cancer, if you have one, or just give you a good skin exam. And then one more resource, also on the aad.org website, they have a Spot Skin Cancer campaign. And it'll give you, again, some of the things I talked about sun protection and how to perform a self-skin exam at home. But if you want to be screened for skin cancer, there are some free skin cancer screenings out there. And you could click on that Get Screened for Skin Cancer link in that first screen. And you can see on the right-hand side, I have another screen that shows you, for example, 2 dermatology practices that are having upcoming free skin cancer screening. And so, these are dermatologists that are donating their time so that the public can get screened free of charge. And that's a nice resource for the public to make sure that everybody has access to a skin cancer screening. And you can even sign up for an e-alert where you can be notified of one in your area if one is done. And a lot of dermatologists will help sponsor these, typically in the month of May, which is Skin Cancer Awareness Month. So those are some tips and tricks for taking care of your skin while you're running marathons. And I hope this information is helpful to you. And good luck in your next race. Thank you.